63-year-old Russell Terry of Watauga may be retired, but he's not idle. He never has been.
Got my first job when I was 11 years old. At 14, I started working on a dairy farm. I studied agriculture. I was real good with remembering plant names and genus and species. That led me into horticulture and landscaping and nursery work.
Nowadays, Russell stays busy at a more leisurely pace, but his retirement years took a scary detour one morning while walking his dog.
He saw a cat and jerked the leash. I felt a tinge of pain in my back. I called my wife and said, I'm coming home.
He was in such severe pain that he could not walk to the car. We had to call an ambulance.
The MRI scan of his back showed a disc herniation, and that was putting severe pressure on the nerve, causing pain down his leg.
While in the hospital, conservative treatments were attempted first, but failed to bring relief. Surgery was needed.
The surgical plan of action, because of the difficult location of this disc herniation, was a minimally invasive technique of removing the joint to decompress the nerve and take out the disc at that level. Because the disc is behind the joint and the joint has to be removed, stabilization has to be restored at that level with screws above and below that level with a fusion. Everything went very well with his procedure. His pain was fully resolved and he was able to get up and get walking with therapy shortly after surgery.
3 months after the procedure, Russell was back living a normal life.
I am pain-free. I am back to my regular activities.
We have recently taken a 2-week road trip to South Dakota, Colorado.
I definitely recommend Texas Health HEB. I find them the most professional and the most comforting of any of the hospitals that I've used in this area.
The nurses and the nurse stations are wonderful, and the doctors that practice there are some of the best. It is our hospital of choice.
Here at Texas Health Resources HEB Hospital, there's been a recent in 2020 expansion to include larger ORs and also to help my ability to perform more complex procedures that were previously not done here. That includes a new navigation imaging machine that helps with removal of brain tumors as well as navigating instruments for performing complex spine procedures.
I am back to my regular activities, my hunting, my riflery, my gardening. I am not bad for 63 years old. I'm grateful for being pain-free and being able to look at these opportunities again.